Tuesday, the 7th July 2020. Good morning and welcome to Joy News at 6 with me, Maxwell Agbagba. Almost 1,000 new cases of COVID-19 in a single update, a total of more than 21,000, 7 new deaths and a death toll of 129 people. COVID is real.
We'll be burying 5 at a go. We're going to bury more. We only want to alert the public. The COVID is real, and therefore protect yourself. Observe the national protocol measures to protect yourself, protect your family.
The news is live from digital address GA0993341, available in Accra on Joy 99.7 and Hits 103.9 FM. In Kumasi on Love 99.5 FM, affiliates across Ghana's 16 regions, including ATL FM in the Central Region, Fafa Radio Volta, Golu 91.7 in the Upper West Region, Radio 4BC in the Upper East Region. Around the world, it is at myjoyonline.com. Coming up, another huge jump in rates of coronavirus spread in Ghana, with nearly 1,000 new cases in a single update, the highest since March. Meanwhile, as infections saw the minority in parliament demand shutdown of schools and postponement of final year exams following outbreak of the virus in some senior high schools.
Is it not better to have live wards, even if they become illiterate, than to have kids in school who may not even see the light of day?
Also coming up, Electoral Commission institutes queue management system to address overcrowding at registration centers as fears grow over possible spike in Ghana's COVID-19 cases.
I don't know whether we will decide that we are going to conduct election on the 7th December. But if we are going to conduct the election, then all that we are done, so are supposed to be done, should be done.
The Commission has meanwhile dismissed 3 temporary workers following the stealing of registration forms from its Sangnerugu office.
In business, commodity research firm Isoko proposes an efficient post-harvest management system to help sustain expected reduction in food prices in the long term. More at 6:15.
And later in the bulletin, newly confirmed running mate to NDC flag bearer, Professor Opoku Ajiman, vows to give her all to deliver what she calls a resounding victory for the NDC in the December election. Let's settle for the details now. There has been yet another huge jump in the number of persons contracting the fast-spreading coronavirus infection. The country recorded 992 cases in a single update, the highest since the outbreak in Ghana 4 months ago. Ghana's case count is now more than 21,000, with 129 people dead. In the latest figures, the Ghana Health Service reports that 7 more persons have died. Head of our health desk, Fred Smith, has more.
It is what Ghana dreaded when the virus began spreading and killing people in Asia, Europe, and the Americas. Each day has come with its own challenges, including a surge in cases, deaths, shortage of PPEs for medical professionals, the lack of reagents and test kits, among others. With the restrictions eased and some mass gathering activities underway, the figures are skyrocketing. A group of medical professionals who want the ongoing compilation of voters' register stopped say they foresee a significant jump in the number of cases in the next few days, and that could lead to thousands of deaths. But even before the ink on that letter could dry up, 7 persons have died, sending the death toll to 129. As many as 5 of those deaths occurred in the Ashanti region, where diabetes, hypertension and cancer blamed as the underlying conditions. One of them had no underlying condition, the strongest indication yet that the virus is complex and deadly. Infections also increased by 992 in a single day's reporting. That's more than double the daily average in the last 2 weeks. This brings the country's tally to more than 21,000 cases, figures no one imagined in February. Yesterday, the WHO warned that Ghana could face crisis if urgent steps are not taken to slow the spread of the virus.
Fred Smith there. Meanwhile, the minority in parliament is demanding shutdown of schools and postponement of final year exams after COVID-19 cases were recorded in some senior high schools. Some parents yesterday stormed the Accra Girls Senior High School to withdraw their children after 6 of the students tested positive for COVID-19. Here is Bulsa South NP and member of the Education Committee in Parliament, Clement Apak.
where they are getting infected, and indeed when they become sick and, God forbid, if they die, then what is the purpose of this exercise? Is it not better to have live wards, even if they become illiterate, than to have kids in school who may not even see the light of day? I think what has happened in Accra Girls makes the case that the best option now is to postpone the exams.
Bosa South MP and member of the Education Committee in Parliament, Clement Apak, the Ghana Education Service and Health Service have issued a joint statement on the matter. My colleague Joseph Akable joins me in the studio with more. What is contained in the statement, Joseph?
The statement confirms COVID-19 outbreak at the Accra Girls Senior High School and gives the breakdown as follows. 6 students, a teacher and a teacher's spouse have all tested positive for the virus as at yesterday, July 6. It adds that a team of experts from the Ghana Health Service at various levels, led by national officers and colleagues from the Ghana Education Service, have been to the school to put the necessary control measures in place and assures the general public that all parents and in accordance with the laid down protocols on the pandemic will be followed. 6 persons have been taken to a treatment center for further engagement and are currently doing well.
What steps have been taken in view of the outbreak?
All contacts of confirmed cases have been identified and separated from non-contacts according to the statement. It adds that testing of all contacts of confirmed cases have started and the school authorities with the support of the assembly are in the process of disinfecting the affected dormitories. And there's a continuous public education sessions for staff, students and parents on COVID-19.
Joseph Akable with a joint statement from the Ghana Health Service and the GES. Still on the coronavirus pandemic, 91 medical staff of the Kolebu Teaching Hospital have so far tested positive for COVID-19. The facility has been forced to suspend non-emergency surgery and urgent cases at least for the next 2 weeks. Latif Idris has been speaking with the head of public relations at the facility, Mustafa Salifu.
This is Ghana's premier hospital, and coronavirus is wreaking havoc here. As at the end of June this year, about 71 health professionals had tested positive for coronavirus. Today, the figure has changed. 91 health professionals here had tested positive for coronavirus.
The hospital management decided to suspend non-emergency and urgent cases for the next 2 weeks. There are reasons for this. One is to protect our clients and patients, and then 2, to also protect the rest of staff who are still at post and then providing care to patients.
How many of your staff have been infected with COVID-19?
We have about 91 staff members who are infected with the disease.
Latif Idris reports there. To some election-related issues, now the Electoral Commission says it will admit only 150 people at the registration center under a queue management system designed to address overcrowding. This is, however, taking place here in the Greater Accra region alone. The latest decision by the EC comes on the back of mounting pressure to suspend the ongoing exercise as Ghana's coronavirus case count surges. Here is Director of Electoral Services, Dr. Sribo Kwaku.
We generate the 150, give them out to the people in the queue. Then those who have not, who don't fall within their capabilities, they will generate the following day's date and give it to them. So when they come the next day, they'll be considered. We have increased the number of mobile teams so that whenever there's huge numbers at the center, the mobile team to move in to help clear the people in the queue.
You heard Dr. Sribo Kwaku. This is your election headquarters to the camp of the NDC. Newly confirmed running mate to NDC flag bearer, Professor Nana Opoku-Agyeman, is this morning vowing to give her all to deliver what she calls a resounding victory for the NDC in the December elections. Former President John Mahama presented her to the party's top hierarchy yesterday, and she received what has been described as an overwhelming endorsement. She becomes the first female running mate of any of the 2 major political parties. Head of our political desk, Evans Mensah, has more in the following report.
Within minutes of her confirmation, jubilation erupted in her home constituency of Commander Edina Eguafu-Ebrim. Among some market women in this politically critical central regional constituency, we learned later that Professor Opoku-Agyeman had in fact been a patron of the market women here. Samuel Kudjeto Ablakwa, who served as the Prof's deputy at the Education Ministry, dismissed critics who say Professor Opoku-Agyeman lacks the political ground game gravitas to help the NDC win the elections.
You should see her groundwork, how she touches base with ordinary folk. She doesn't like to be seen as elitist or somebody who is not down to earth.
It has also emerged that Professor Opoku-Agyeman has been a member of the NDC for 7 years. Will this be enough to convince the grassroots of the party that she has indeed paid her dues to the NDC?
Professor Jenano Opoku-Agyeman joined the party just recently.